Hey there, if you are recovering from a concussion injury, one of the main things that you want to focus on during your treatment is returning to your normal activities and gradually increasing your activity level without worsening your symptoms or delaying the healing process. So when you're in this phase, regardless of what the activities are that you're trying to increase, which I'll give you some examples of here in just a few minutes, you can use this rule of thumb for generally increasing your activity level over time, and it's called the 2-point rule. So again, you're in the treatment phase of concussion. Hopefully you're past the initial rest period where you're not doing a whole lot just to kind of let things calm down. Now you can start to increase your activity level. So if you're an athlete, let's say you're trying to increase the amount of jogging or running you're doing. And so let's say at this moment in time you're an athlete, and let me back up though. So the symptoms you want to monitor, there's lots of symptoms with concussion. So I did a different video on that. If you want to look at all the different symptoms from things like headaches, dizziness, there's all sorts of symptoms on our kind of our clinical inventory here. So there's lots of different symptoms that you're monitoring, but you're going to pick each symptom, and then as you're returning to your activity level, that's when you're going to use the 2-point rule. So again, for example, you're an athlete and you want to increase your running, and let's say your headache is a symptom that you're really focused on with that activity that tends to worsen. If your headache on a scale of 0 to 10, 0 meaning no headache and 10 being the worst headache imaginable, let's say you start at a 2, so it's pretty mild. What this rule then says is that as you're trying to increase your level of running, either duration or intensity, is that you don't want it to go from a 2 to a 4. More specifically, when it goes from a 2 to a 4, that's when you know you need to rest again and back off and let your symptoms come back down, and then you can resume activity. So the 2-point rule is really useful, again, as you're trying to gauge how much can you push, how much can you increase your activity level without slowing down your recovery process. So that's a common example for an athlete. Let's say you're just at home and you get headaches or you get blurred vision or any of the other symptoms that are bothering you from your concussion when you read or when you're on your tablet or your smartphone, something like that. So again, we apply that same 2-point rule, and let's say that you're at a 3 out of 10 when you start the activity. Well, as you start to do the activity, if you reach a 5 out of 10, which is 2 points higher than 3, that's when you want to stop the activity, rest, let your symptoms come back down. So again, just a quick overview of that 2-point rule. I think it's very valuable in terms of just gradually, grading up your activity level, the physical activities, the cognitive activities, things like that. So it's just a good rule of thumb to help you advance your treatment, advance your progress without making things worse and slowing things down. So if you have more questions, leave them below the video. Obviously, if you're in the Spokane Valley area, we'd love to treat you for your concussion, help you make a full recovery. And if not, definitely find a provider in your area who can help and who specializes in concussion treatment. That's it for now. Thanks.